Hello everyone, this is David, Occupational Therapist, working at Alpha Pediatric and Rehabilitation Center. Today this video is about sensory processing disorder and speech problem among children. Firstly, we can see about the sensory processing disorder. It is a disorder in which individuals experience difficulty with processing information from their surrounding environment and reacting accordingly. Based on a psychological condition in the brain, common symptoms of sensory processing disorder in children include anxiety, inability to focus, agitation or stubbornness. Every individual with sensory processing disorder reacts differently, mainly because the five senses play a large role in how the disorder manifests itself. The five senses of every human being are vision, sound, taste, touch and smell. These senses allow us to learn about our surroundings and react accordingly. When we touch a hot utensils, our hand will quickly retract. When we see a speeding car rushing towards us in the street, we step back to avoid an accident. A person struggling with sensory processing disorder recognizes these types of warning signs, but can also feel danger or discomfort to things not usually associated with fear. The glare of a particular lighting setting or the feel of unfamiliar fabric can send a child with sensory processing disorder into panic. Seemingly unobstructive events like a gentle rain or a tickling sound of a clock can cause extreme discomfort. Impact of sensory processing disorder on speech problems. When a child struggles with sensory processing disorder, not only it will affect their daily behavior, but also the acquisition of speech can also be impaired. Many children with sensory processing disorder are also diagnosed with a speech delay or aphasia, which means a difficulty in conveying their spoken language. This can occur when a child is sensitive to sound and has trouble discerning the auditory information around them. If a child cannot discern between particular voices or is unable to focus on words being spoken to them, it can result in missing valuable time to increase vocabulary and verbal communication. Another fact that can come into play is difficulty in oral stimulation. When a child struggles with chewing anything except pure foods or cannot suck or swallow properly, the child may not be developing their mouth muscles enough to even gain their dexterity to speak. For children with sensory processing disorder, the therapist will generally help to increase their verbal skills, improve articulation, and strengthen their oral motor control. They can also help the child to expand their language skills, which are often decreased due to vestibular or auditory dysfunction. In more severe cases, where a child is unable to speak, the occupational therapist and speech language pathologist may explore options of alternative and augmentative communication. It is a form of communication other than speech and uses sign languages, pictures, symbols, and electronically aided communication devices to support the individual's communication. To help alleviate these increased sensitivities, children with sensory processing disorder can benefit greatly from occupational therapy and speech therapy. The therapist can help children working on sound development, but they can also hone in their feeding issues, which greatly impact the ability to speak. A typical therapy session for those with oral sensitivities can include trying varied foods or eating in a different way, like sipping and sucking like this, to help stimulate the oral muscles. Also, occupational therapists gradually increase different food textures into the child's routine and their diet. Children with sensory processing disorder may refuse to eat certain type of foods due to their textures and sensations. Working closely with occupational therapist and speech language pathologist will help to decrease this negative reaction to certain foods. The main aim of occupational therapist among sensory processing disorder will be to maximize the child's communication to their highest potential in their school, home and the social environments. Thank you everyone.